Amiodarone. For this infusion, we will need a 100 milliliter bag of D5W, a Sapphire Pump 20 drop set, one vial of amiodarone containing 150 milligrams in 3 milliliters, a blunt fill needle, an alcohol prep, and a 3 ml syringe. To start, remove the cap from the medication vial. Clean the rubber top with the alcohol prep. Assemble your 3 ml syringe and blunt fill needle. Withdraw all 3 milliliters, or 150 milligrams, of amiodarone into the syringe. Note, you may have the 450 milligram vial of amiodarone. Know that the concentration is the same and we are still going to be withdrawing 3 milliliters. Inject the 3 milliliters of amiodarone into the 100 milliliter bag of D5W. Safely dispose of the needle and syringe in a sharps container. Gently mix the medication and its diluent by tipping the bag back and forth. Spike the bag of D5W with a Sapphire Pump drip set. On the back of the cassette, we can depress the flow stop tab that will allow the D5W to flow through the drip set. Once all of the air is expelled, we can release the tab to stop the flow. Next, we will install the cassette into the chamber. Place the forks on the bottom of the cassette into the pins and pivot the top to the side of the cassette into the pump. You will hear an audible click when the cassette is properly attached to the pump. Close the cassette door. It will latch shut. Tap the on-off button. The pump will run through a brief warm-up and self-test. Notice the clinical care area, adult or peds. To change the clinical care area, select Change on the bottom left and select the appropriate clinical care area. To accept the clinical care area as shown, tap Accept. Select New Infusion. Tap 2 one time for A. Tap Find. Select Amiodarone VTAC, 150 milligrams in 10 minutes. Select 150 milligrams in 100 milliliters. Select volume to be infused. Enter 100 milliliters. Select OK. Select dose rate. Per EMHIS, we always select the number in red on the right-hand side. For this example, enter 15. Tap OK. Notice the time for our infusion has been auto-calculated at 10 minutes. Select OK. On this screen, we can verify all the information entered is correct. Our medication we are administering, the rate of infusion, volume to be infused, the time in which it will take to infuse the medication, and the concentration of our medication. If all of this information is correct, tap Next. We will now confirm that we are administering 150 milligrams in 100 milliliters. Tap OK. Tap Start to start the infusion.